Hey, Jeff.
How we going? How you doing?
Good. How are you doing?
Good. So can you see, we're just setting this thing up. Or can you see me or no?
No.
Okay. Well.
So he must have the video off because now he turned on the audio and now there's the mute button, which we normally see. He must have the video off for the meeting.
So okay. So is my video working or not?
No. All I see is your name. It's almost like your computer's not connecting to your camera.
Sean?
Yeah.
Are the cameras off for the participants?
You certainly shouldn't be.
Yeah, you should be able to see me, but I'm just seeing apparently it's a blank screen or a dark screen with just my name.
That's all I see on my end as well.
So what do you think is?
Well, it seems like he did a webinar, so I'm trying to see Zoom webinar participants. It's different from the actual meeting.
And I'm good. Sean, are you okay if you don't have a video of me?
Sure.
Okay, then that's fine. We can do that, Sal, and just figure it out later. Yeah.
Okay.
If we can fix it in the next couple of minutes, I try to hopefully do that.
Okay. We'll give it. What do you think, Sal?
Well, here's the link. They're similar to how he has muted you. They allow you to open up your video by doing the same thing.
It'd be nice if we had another attendee so we can see what's happening for them.
The thought is, Sean, if you have how you have the controls for muting and so forth, you may have the controls to also allow video.
Okay. Okay, I'm looking into it.
No, I think there's a few, right, Sean? People that are attending?
Yeah.
Yeah, I think there's probably maybe 4 or 5 people.
Okay, I went in and made a change. Why don't you log in and why don't you log out and log back in?
You know, log out and log back in.
It's like literally leave the meeting and then come back in.
Okay. So I'm gonna get out of this real quick. So can you, oh, still not there. Okay. No, it's not it.
Um,
What do you think, Sal? Any other thoughts?
Currently looking.
who is Nancy Aspiro?
I
Show.
do not know.
Hide non-video participants. So where you saw your mute button or unmute button, there should be a video button as well.
So Sean, so I'm being told that where the your mute button, so you can control the microphones for, or this, yeah, the you control for each of the participants. You can control the volume or the microphone. There's also a video button apparently.
Yeah,
How
right.
you
I have the option of saying mute or more, and under more it says disable talking chat, promote panelist, rename or remove.
Okay. There's no video one?
No.
Nope.
Do you know who Robert Gronich is?
No.
What are these people?
Because you just had the five, right? It's Meredith, Katie, yourself, Dr. Vo, and me, right?
Yeah.
I think it'd be possible for him to assign you as a co-host. That way you can control your own options.
Yeah, it's so I think we'll just leave it off. That's fine.
Okay.
Okay, I think I appreciate it though. I think Sean, I'm just gonna, you won't have my video. That's all.
Okay.
And that's fine. Thank you, Sal.
No problem, Jeff.
Okay. All right. Bye bye.
Yes.
Sean, are you there?
Yeah, Jeff, can you, so Meredith is joined with video.
I'm not sure what's the problem here.
Probably back out, leave the meeting and come back in one more time. If it doesn't work, we won't force it.
Okay, let me try getting out again.
Hello. Can you hear me?
Yes, we can hear you. We're working through some technical challenges for a moment, folks. So just
Okay.
bear with us, please. Sorry for the confusion.
My camera is not on, huh?
Robert says that I can see and hear all of you. Interesting. So Meredith, did you do something special for when you logged in?
No. So, Dr. Bo, is it giving you the option to start with video?
Nope.
No? Okay.
Yeah, I'm running into the same problem as well.
Alrighty, let's see. Do you need the window?
Yeah, the chat, raise hand, Q&A. No. Okay, let me do it again.
Close it out and then
Is Katie on?
Katie had some personal matters in regards to her child care.
Okay.
We're having some issues. So she may not be able to join us.
Okay.
What do you think, Meredith?
Technology is not gonna win. We can make this.
That
This is part of the new normal, isn't it?
it is.
promote to panelist. Okay, and then Dr. Bo, promote to panelist. Okay. You should be having option already, Jeff.
Oh wait, I see now.
Woohoo!
Video.
Oh, Meredith, I see the video option.
For
What it's
For
saying,
both?
is telling me that you cannot start your video because the host has stopped it.
Yeah, same here.
right. We're almost there.
Halfway there we are.
We can do this. On. Let's see.
No, not me. Because the host didn't let me.
Hmm? I'm trying to let you.
Yeah, now I have the little video icon that I could normally click and let them do it, but as soon as I go towards hovering over it, it disappears. Wait, what if I click on change role to attendee for Jeff and Vo, Dr. Vo?
I switched them to panelists for them to be able to have the video.
I wonder what the difference is between attendee and panelist.
I don't know.
You want me to try it?
Sure.
Jeff Lamoure will be rejoining the webinar as an attendee.
Okay, let me exit and do it again. Let's see. One more time.
Okay, Jeff is back.
Mm-hmm. But he doesn't have the video icon. There you go.
There's Dr. Vo.
Woohoo! Okay.
Okay,
Halfway there.
we have Jeff.
So I guess let me get out and get back in then.
Okay. Sorry, folks, we'll get this figured out.
So what I did, I clicked on an option that said allow participants to use video. So, I don't know, Zoom. Okay, now we have to make this to go live into Facebook. For everyone who's joining us, we're gonna go ahead and start in a couple minutes.
Okay, there's Jeff. promote to panelists. Should I do that? Should I promote Jeff to a panelist?
Mhm.
There you are, Jeff.
I told you that technology is not going to win.
All right. Okay, so I'm going to go ahead and live on Facebook. Right, Meredith?
Yes.
Okay. Do I click start on the event?
Yes.
Hey, Meredith, how do we tell if we're live? I think we're live.
We're live. Okay.
How do we see the attendee list, Meredith?
Current participants and attendees. It doesn't, in my Facebook, doesn't look like live.
Okay, I'm going to start over.
Okay.
Okay, Meredith, how do we look now? Are we live?
Let me see.
Oh, it says live preparing.
Okay.
Still preparing. Now I think Facebook is kind of holding us up. It just says live preparing still. Sorry, folks, we're just waiting for Facebook to let us in.
It's not letting you in.
It just says preparing. I think we're hung up.
Probably there is a lot of traffic right now.
Do you think I should hit stop live stream and try it again?
Mhm.
You want me to share it in the event, right?
And whatever.
Okay, here we go. Trying it again.
So we're live now, Sean.
Okay.
Finally, Facebook let us.
Okay. Okay. Sorry, folks. We had quite a bit of technical difficulty with multiple platforms that we're trying to use today. So we got through it. Thank you, Meredith, for all the help. And thank you, everyone, for being patient. You know, what we're going to start off by doing is just a brief introduction, starting off with Meredith. Let's each of the panelists go through and introduce yourself and let us know where you're from.
Hello, everyone. Well, thank you very much for joining us. My name is Meredith Garcia. I'm the director at the Imperial Valley Small Business Development Center. It's a pleasure to be here. We offer counseling for small business owners. We are a research partner with the U.S. Small Business Administration. So we have a lot to talk to you about.
Dr. Vo? Oh, you're muted.
There you go.
Okay. Yes, thanks for having me here to talk to all of us in Imperial County about the COVID-19, and I'm glad to be here.
Thank you. Mr. Lamoure?
Hi, good afternoon. Jeff Lamoure with Imperial County Environmental Health. I'm the Deputy Director of Environmental Health, but also I am assisting the public health department and part of the public health department, assisting the public health department on our roadmap to recovery.
Thank you, Jeff. And my name is Sean Wilcock, and I represent Imperial Valley Economic Development Corporation, and I also work with Meredith at the Small Business Development Center. And so Meredith and Dr. Vo and Mr. Lamoure are kind of the rock stars of our community, about, involved in helping the business community with access to loans and access to capital, as well as providing the business community with the tools that they need to operate in a safe as possible manner right now with this COVID virus, and also provide the business community with the tools that they need to open and maintain a safe environment in their workplace. So, some of the topics that we're going to cover are around providing the business community with tools that they need to move forward in a safe manner. So, beginning off with Dr. Vo, he's going to talk a little bit about the different types of testing that's out there, that's being utilized out there in the community. And then he's going to talk a little bit about the type of test that he administers through his offices in Calexico and El Centro. And then he'll talk a little bit about the services that he will provide to businesses in need as they need to learn how to set up their workplace. And then we'll move on to Jeff, who's going to talk about the county's role in how they're setting up a mechanism, a worksite checklist that businesses can use to ensure that they're doing everything that they can to maintain a safe work environment. And then at the end of it, we'll open it up for Q&A with the business community as well. So Dr. Vo, would you like to go ahead and start us off?
Yes, thank you, Sean. I'm here to help the community and help the Imperial County. Hopefully we can reopen and the business safely. And today I'll talk a little bit about the tests and how we're going to prevent. I think the key here is how to open it safely. Not the time, but when are we ready to do this? Of course, we're going to follow the guidelines from the state, governor, and the county, and of course the city, and all of that we have to follow. For us as a medical doctor, I would like to have some also protocol for us to execute. So hopefully we can avoid those crises or outbreaks in the near future. So we talk about the test. We have two kind of tests. And actually here's also, we have my wife, Venus. She's also not practitioner. I think I'll let her talk about the test. She's, but I'll talk a little bit more about the safe workplace, how we're gonna make it safe for everybody. So for the safety conditions or office or business, I think the more important thing is we, like we talked before, social distancing. We have to apply that for everywhere now. We have to have social distancing at work. That's, I think, is number one. So if you have your workstations or small groups in your office, to avoid the office to have to close if it's disinfect or infect all the offices and staff. So that's why I recommend highly social distancing at work as well. After that, of course, mask and face shields depends on what kind of work do you do. But if you in contact with the customer, with the people around you, then of course wear gloves and wear mask or face shield to reduce the risk. But the more important thing is, I think I in my office and everywhere else, I see when I talk to the patients, family exposure. That's the key. For example, we work in the office, no problem, we are good. But when you go home, grandpa, friends come over, and those are the people that really you get infected and you bring to work. And that's I think we have to advise and talk to our employees that be careful at home. At work, we try our best already. And of course, we know what we're doing here. But at home, we don't know what our employees doing. So that's also very important. We get a lot of exposures in our community. And one person in the household has it, the rest will have it almost for sure. So that's why family exposure very important. We'll have to double and triple check on those. Stay home after work also very important, because we don't want people to go out and get infected from others. So stay home very important. And any flu-like symptoms, of course, please call MD, medical doctors. Of course, I can be available anytime. So anybody can call and ask for the consult, or come walk in, or come to our office, or walk into our office. We can discuss, because we want to make sure that all employees and all people out there are safe and feel comfortable and in a working environment. And in the office, we also recommend we can test all staff, or we can do randomly. So it depends on the kind of work that you do. But I will recommend we have to test before we open, to make sure we start fresh and start safe to be started with. Otherwise, staff and employers and employees, they don't know who's infected, and that can create a chaotic in the work environment. And of course, every office now need to have hand sanitizers. Doesn't matter what you do, we need to have hand sanitizers to make sure that we can be safe, and at least we have to do wash with soap and waters. We have to do that because very important of hygiene, very important to avoid or reduce the spreading. And again, those are the things that I think we can provide, but more important is the test and the medical knowledge, and we can even consult and come to your workplace to help all the business to train staff, to train the owners, to make sure that we know what we're doing. And now back to the test, and I would like to introduce my wife, Venus. She's a nurse practitioner, and she'll talk more about the test. And of course, I'll be here. Any questions from the audience or from everybody, we can answer that as well. Okay.
Hi, my name is Venus, Venus Nguyen. I'm a nurse practitioner, and I'm going to be talking about the different type of tests that we are offering in our office or at our facilities. So we have two different facilities. One is located in El Central, and the other one is located in Calexico. And we're offering the same tests at both locations every day, Monday through Friday. And then over in the Calexico office, we offer it on Saturday and Sunday also. So the two tests that we're using, or everybody is using for the COVID testing, is the first one is the nasal swab, and it's a very popular one. Another scientific name for it is PCR, short for polymerase chain reaction test, where a nasal swab is going into the nostril, or also you can do it through the oral route, and it's a diagnostic test to diagnose active infections of COVID-19. The other one is the rapid serology test that comes in a kit, and it's a rapid 15-minute test. That one first came out when all of this first started back in early March. It is issued through the Emergency Act, and those kits are rapid, but we found that those are not as accurate. So now we're offering the serology, it's called the high quality blood draw serology antibody test, and that's to find out if you have past infections and if your body is developing antibodies. So that is not the test to diagnose the patients. And that if we do the blood draw, then it will take about 3 to 4 business days. Okay. But the diagnostic one takes about 2 to 4 days right now, and they are being sent out to the labs, to LabCorp and Quest. Right now in Imperial County, the hospital, at the outpatient clinics, the county public health departments, all the doctor's office in the communities are collecting them and are sending them out to LabCorp and Quest, and they are high complexity labs that can process these. And again, turnaround normally takes about 2 to 4 business day, and I know that it can be a challenge for a lot of business owners, because if there happens to be an outbreak at work, they would have to lose their workforce for at least 2 to 4 days until the result come back. So right now we're looking into getting the same test, but in a different test kit. It's also FDA approved, and it only takes 45 minutes. It does the same things, but it's in-house. So that way, if let's say a worker or an employee came with symptoms, or he or she was recently exposed, and he or she is not sure if they have the infections, they can go into the office, and we can do a swab right then there, and within 45 minutes, we'll be able to let the employee know, and the employer communicate with the employer and let them know whether or not if it's just, you know, a common cold, a flu, or if it's COVID-19. Okay. We also have the nasal swab to do the influenza, and that also takes 45 minutes. And the nasal swab is used universally, so you've seen that a lot throughout the world. Everybody is using the nasal swab to detect viruses, and then we also use that to detect bacteria also. So that's really good news. So in the Imperial County, Vol Medical Center does have the it's called high complexity laboratory that can run it. Not everyone can do that. So regular doctor's office or regular urgent care that doesn't have the certification, it has to be a high complexity laboratory that could run those cartridge and run those test kits. Not everybody can do that. So that's a plus. So one of the criteria I know for reopening the local economy is that the public officials needs to assure the public that there is enough testing, there is enough testing capacity to accommodate the general public and the workforce. So we at Vol Medical Center have been doing it from the very beginning. We were the only one that offered the diagnostic PCR test since March the 23rd. We were the very first one that did that and continue to do it till today. This past week and this week, we've seen a surge in the number of people that from the community and also from the workforce that came in to get tested. You name it, from anywhere from Walmart to Costco to the Border Patrol to field workers, basically everyone. And we see that the majority of people who are coming in are coming through work because somebody at work came positive and they exposed themselves to other workers. And then essential workers who, let's say for example, and when I talk about essential workers, I'm talking about cashiers working at supermarkets, at Walmarts, food delivery trucks, that came into mass contact during the day, and they only wearing a regular fabric mask. And sometimes they have to come in close contact with their customers, and there's no barriers. So that can be a problem, especially if there's an outbreak, at work. So recently I've recommended that an added layer would be for those essential workers that has to come in contact and there's no additional barriers, to maybe put on a shield. So that way, if they happen to have like a fabric mask on, right, the shield would help as a barrier to help prevent particles from coming in and out. of that person. So that could be an added measures for those essential workers. And then at workplaces, they would be wearing masks and keep their distance, but the places that would be contaminated would be in the dining area where they're sitting and eating. And if it gets contaminated, then the staff would get really paranoid and they would want it to go get tested. So recently I have recommended some of the employers, if possible, that they can eat, the employee can eat at their own station. So everything is done at the stations where everything belongs to that person. So if the person happens to be sick or infected, that they don't disinfect other, first of all, because they work in their own cubicle, and then they don't spread it to other areas at work.
So Venus,
possible.
yeah, let me just see if we can break down the differences in between the two tests, because you know, the community, they really need to know which is going to be the most efficient and effective test for the money that they're going to be spending for their workforce. And so what you're saying is there's a rapid test, and that has a less accuracy rate, right? And then you have a high complexity test that you guys are providing at the medical center that has a very high accuracy rate, so that we're avoiding a lot of false positives, because it's those false positives that's, you know, creating a lot of fear in the workplace and causing a lot of workforce to basically leave their workplace out of fear for their own health, and then come to find out that was triggered by merely false positives. So we don't want to go in that direction. We want to go with the most accurate, efficient test that we can today first, right? So
the most accurate and the most reliable test.
Okay.
And the right test too. The right test, because
high complexity test, right?
Yes, because you cannot use a serology test to accurately diagnose an active infection. That doesn't tell you that. So the diagnostic PCR, the nasal swab, is the test for diagnosing active infection.
Okay. So, you know, for the business owner, aside from knowing, you know, the most effective test that they can ask for, what other kind of services will Vo Medical Center provide to the business owner to help them understand, you know, how to set up their workplace to be safe?
Yeah, so I think I will leave that to you. I'm just putting in a couple of suggestions because you know, we are, you know, we are the front lines. We come in contact with a lot of people. Like I said, workforces, employees, employers, and then regular folks. So we see how the infection is being transmitted. So we're just giving tips when we see it. And I just give you a few tips, and I'm pretty sure there's a lot of people here on the panels that have much more experience and you know, and we'll be putting out guidelines for the business owners. But as far as me, I see that a lot of times, again, at workplaces, the boss are assuring the staff, you know, that they must keep 6 feet apart and put the mask on. But the problem is in the break room, and the problem is during lunchtime. Yes, that's where they get into a small area, and then if one person's get infected, they can contaminate the area, the common area, and then they have to shut down the business and disinfect. So if possible, if there's a workplace with a cubicle, everybody just stay in the cubicle and do everything in the cubicle, including break time and meal time. That would help. And that way, if one person get infected, it would just be that person that would leave the workforce and not everyone. And that's that. And then as far as the testing go, we're very accommodating. If an employer have an employee that is sick and is needing the test, they can just send the employee over, and the employee can come in as a walk-in anytime during business hour, and we can see the employee right then and there, assess the employee right then and there. We can do a couple of tests first to rule out that it's not COVID, okay? And nowhere else does that because we have the laboratory in-house. So we're able to rule out influenza and make sure it's not influenza, because influenza and COVID is very, the core symptoms are very similar. So it's very hard to differentiate. So at least we can rule that out, and it only takes 45 minutes. Okay, rule out, influenza. And if, influenza is out and patients still have symptoms, then of course we're gonna run the COVID. So it depends on the availability. And like I said, we're getting more cartridges this week, and we're able to, to utilize that for emergency cases, like for people who are really sick and are wanting to know right away that it is COVID and not an asthma flare, not anything else, then we would run it really fast. And then the other people who have mild to moderate symptoms that doesn't need to know right away or is not an emergency, then we use the one that, that probably will need to wait for at least 2 to 4 days. So as we go, we will try to get more cartridges, more testing available. But right now, on average, between the two offices, we run about 500 tests a day, and that's the most out of everyone here in the Valley. And then after that, we communicate closely with the employers. Employers can call and ask, are the results back? Of course, we can let them know, yes, the result is back, not back, but we can't disclose what the result is unless the employee give a verbal consent to go ahead and let us communicate the results with the employer. Then we can go ahead and do that. But the employers are welcome to call, and like I said, we have a good open communications with the owners, the employers, because we know that having employees not being able to work is going to be tough on the business. Yeah, so we try our best to accommodate.
How should a business owner get a hold of you?
Just by calling into the office, and we have a call center. We have 6 staff just sitting on an average day, 6 to 8 staff just sitting and answering phone calls.
Okay.
Yes.
And that number is 760-352-2551, correct?
Yes, correct.
Okay. All right. So just before we move on to Jeff at the county, we do have a couple of questions for you, Venus, from Jose Guzman. Once an employee tests and results are negative, when do we test after without symptoms? So I think he's asking when should we be retesting?
If he tested positive the first time, he has to shelter in place for 2 weeks.
If they test negative, when should they retest?
Oh, okay. So if they test negative and then they start having symptoms, right? After they tested negative, they can go ahead and we can repeat the test again next day, as long as patient is symptomatic.
Okay. Okay. Jose also has another question. For those who work face-to-face with clients, can safety glasses work if it covers all sides of eyes, or does it need to cover complete face?
Yes. The reason why I advise the shield is that the shield is longer. So if you happen to talk and your mask is soiled, and you don't have another mask to replace it, right? You don't want those, and this is a plastic shield, right? So no particles can exit your oral route, right? If you happen to be infected or sick, it can't go past this this face shield, this plastic barrier. So that's best. But if you don't have this, you can wear a goggles, and the goggles will protect your eye. And how you get infected through your eyes through the ductal, right here, tear duct, and it's really hard to get in the duct. So a lot of times, the healthcare workers are using the shields, basically, besides protecting our eye, also use it as a barrier to help protect the nose and the mouth. Yes.
Thank you very much, Venus. We have a lot of questions that'll be rolling in, so please stay with us. I think we're going to go ahead and let Mr. Lamoure from the Department of Public Health kind of cover what the county's doing to help businesses prepare for what's going on right now. Specifically, covering the worksite checklist that they have prepared for the business community.
Thank you, Sean. So what I'm going to go over is give the group an overview of the site-specific plan, protection plan. And essentially what's happened is as we transition, and once we're approved through our variants to transition to the high risk of phase 2, we want to make sure that businesses have they're ready to open. They have the mechanisms in place. They have all the preventative measures in place so that they can do that. And one of the requirements that through the statewide guidance documents is that they require that a work site specific plan is created for all businesses. And so it's business specific. As you look at the various guidance documents in the 19 sectors, the majority of them do spell out that a work site specific protection plan is required. So with that, the idea is with this plan, it's going to provide a comprehensive risk assessment of all work areas, and it's going to be tailored specifically to the business. That's the key component of that. In that, some of the things that we're looking at, or the key things they're looking at, is measures to protect employee health. So we're looking at what's happening with regards to daily screenings or a universal screening method. They're looking at if all employees have been provided a cloth mask or some type of face covering. Have employees been provided with adequate physical distancing barriers? So it's business specific, depending on the type of industry that we're talking about. With that, and that's the first section. They also talk about hand washing. So it allows the business to identify where their hand washing stations, in essence, their bathrooms, or if they have additional hand washing stations, depending if it's a manufacturing facility. It also it allows the employer to identify what type of hand sanitizer, not necessarily the product itself, but identifies where they're located, where they're being placed throughout the facility. It talks about disinfectant of all the supplies that are provided, that are available to the employees, and identifying those locations where that disinfectant will be located. The other part of it is the measures to protect customer safety. So the employer needs to be able to reassure customers that are coming into the business that a thoughtful plan has been put together, that also is going to reassure customers that barriers have been put in place, that the employees have been trained, that they've taken every preventative measure possible to ensure that they're going to have a safe environment for the customer to enter. And with that, in that particular section, we're looking at there may be maximum capacity restrictions that could be used to ensure social distancing, social distancing. There could be requirements with regards to visitors and customers to ensure that they are also wearing face coverings, that they have their masks. If there's high contact surface areas, countertops where the registers are, or area where merchandise is maybe laid out, those high contact areas need to be disinfected at a certain frequency. So this plan allows them to spell that out at what frequency and helps them identify those high contact surfaces throughout their facility. It also identifies the method of if there is a payment method for this particular business, like a food facility. Is there a touch-free payment device available? If not, then how is the employer, or how is the facility addressing that measure there? If we're talking about facilities like our retail, a lot of our retail facilities have the push carts or the carry carts. They need to, again, reassure businesses or customers that these carts are being sanitized at a certain frequency between use. So we've seen this in our community. We know Costco and Walmart, for example, have programs in place to do that. But there's other retailers out there that also have these types of devices or carts or baskets, and we want to make sure that, again, the business is mindful. They're going through in their plan, they're identifying at what frequency that they will clean these carts and so forth. So the next measure is measures to keep people at least 6 feet apart. So it's the social distancing. So maybe signage that will be placed throughout the facility or at the entrance of the primary door that's used to enter the facility. It allows the business to identify what type of social distancing measures have been put in place. And for example, we'll see this in a lot of the retail stores right now, at our, whether it's be Costco or well, we'll see them also at Walmart and Vons, where they have one directional signage on the ground. So again, it tries to limit people crossing in front of each other. It tries to it minimizes the amount of activity, or at least the direction that people are traveling down the way. So those are great tools to encourage social distancing and to try to maintain social distancing while people are retailing or shopping in these facilities. So that plan helps them identify those. For our food industry, the plan helps food-related measures to prevent unnecessary contact. So it may be things with our soda dispensing machine. What frequency are they wiping the dispensing devices down? Is there signage to remind the customer not to take a drink and then fill up their cup shortly after that drink, and then coming into contact, their saliva is on the cup and coming in contact with the metal depressor. The next customer that comes behind that they could transfer, and then not only this virus but also other germs that way. So it's having signage to prevent that, or to recommend, to encourage the employee or the customer not to do that. But also, or single service type devices that with lids and straws, and having those available. If they have, depending on the type of facility, if they have kind of a condiment, a buffet type setup, those will not be allowed. We would want to see single packet or single service type condiments using the packets and things like that, making sure that the businesses are being mindful with regards to that, so that they can ensure that the customer, that it limits the amount of contact with that. It may be that the business at these food facilities are, instead of having them available for the customer to pick up themselves, they're actually being handed to the customer as they purchase a particular food item. So it's just, again, helps them to think through their process and develop their plan. There's another section within this site-specific work plan for measures to increase sanitation. So again, it looks like they're looking at, it assists the business to identify those protocols for cleaning. It allows them to identify specific rooms that need to be cleaned at a certain frequency, break rooms, restrooms, Venus and Dr. Vo had talked about the more common areas, or some of those areas that we see exposure to, or people that are more likely to encounter the virus, and ensuring in those lunchrooms, if an employer has, if they break in shifts, that after each shift they go through and they sanitize that facility before the next shift comes in. They have their seating set up in a certain manner to ensure social distancing, but also they've done cleaning as well to ensure that they are trying to create an environment that is as free of COVID as possible, or any other bacteria or virus that's present. So it's just, again, the worksite specific plan kind of walks you through that process, and it's specific to your business. So it allows you to identify those areas that are applicable to you. This is a universal document, so it would be used for all types of businesses. It can be used for all types of businesses. With that, the next step to this is that the state requires, as part of the guidance requirements, is that this worksite plan, it's not required to be approved by, whether it be by the state or by the local health department. You're in essence, the business in essence certifying that they have completed the plan. So whether they post it in their entryway, or they post it in their break room for their employees, they need to have it available. What we're also working on is a poster, so that the site-specific work plan can be posted, let's say in the break room, and there'll be a poster that the employer can check off, indicating that they have completed these work plans and other specific requirements that may be applicable to their business. It's a very simple poster that's fillable for each business, and they can hang that poster either in their entryway of the business, or in a very visible area of the business, so that the customers, again, have some degree of understanding that there was some mindful work that went into determining or to assessing the business to ensure that it is as safe as possible for entering. That's basically about it.
Jeff, when do you think this checklist will be available, and when it is, how will it be available?
So the checklist is available now. It has actually been sent out. This checklist was put together not only by the Department of Public Health, but also through the Business Recovery Task Force, which your organization is a part of. but also through the LHA, the local health authority. So collectively, this team worked on developing this checklist, and then with this, it has been sent out through the chambers. It's been sent out to a number of different venues or through different methods to get out to the business community. We'll have it available on it is available on our website as well. Again, it allows businesses we encourage businesses to download this and to begin working on their specific plan specific to their business. And if they have questions, by all means, the idea is that they can contact us. We'll walk them through that. The next step that I plan on doing is working with our local code enforcement officers, reaching out to the city managers to see if we can use the code enforcement officers, not for code enforcement purposes. We're going to take off that hat, but the idea is that they have that eye when they do inspections. They have that inspection experience, and they can go in and with kind of making sure that we have a standardized approach when we go in and assess businesses. Having code enforcement in each jurisdiction, it would allow us to go in and assist those businesses and provide that oversight if they would like that. We can go through, and I'm doing that now. I'm going through a number of businesses at their request and identifying where there may be problematic areas or areas that they should at least be aware of and how they're managing those to prevent spread of any virus that could be present. So that will be something that we'll have available here pretty quick with regards to at least having the request to go out to individuals to come out and assess businesses. So the plan itself, the worksite specific plan, is available now. Again, it's gone out through the chambers. They can contact their local chamber, and the chamber has that available. I believe they also have it posted, but they can also go to the public health website, icphe.org, and download it there as well.
Okay, so this is primarily a voluntary program, right? But I have to imagine that from a legal standpoint, a lot of business owners are very concerned about, when they do open up, if they're not already open, what kind of liability they're going to be faced with from either their workforce or their customers who may or may not get infected in the workplace or the business place. And so I would think that this really would provide a lot of legal liability coverage, knowing that the business owner took the steps that were recommended by the local health authority, and they've actually posted that in the workplace. So again, this is not mandatory, but it's very highly recommended, right, Jeff?
That is correct. Well, it's part of correct. That is correct. It is one of the requirements under the guidance documents. It is a guidance. That's the key word. It's a guidance document. Obviously, it's going to allow that business. I mean, it's going to be very effective in many ways. It's going to allow the business to mindfully go through and identify what conditions, what measures, what preventative measures need to be addressed specific to their business. But also, again, they have the employees they want to bring back to work. So the employees need to have a level of comfort. So it's, again, the employees knowing that the business owners have gone through this process to identify that should bring a level of comfort to the employee, but also the customer. Again, the customers are going to be hesitant about going into some businesses. And again, a customer knowing that these businesses have taken this process and have gone through this site-specific plan and attempted to address those key elements to ensure that their business they have preventative measures in their business, is going to provide that level of reassurance also to the customers. So it's going to be very effective in that regard.
Okay, so a business owner can reach out to your department and request a walkthrough inspection. Would that be a physical walkthrough, or would that be over the phone, or how would that work? So
we're working on that component right now. What we would like to do is right now what's happening is that if there's a business that is concerned, especially if they have positives within their workforce, they had positive COVID within their workforce, the department has been contacted. I have gone out to businesses to evaluate, to assess their preventative measures and to make recommendations to modify those or to enhance those. Yes, they can contact us if they would like that. I would encourage them to go through the site-specific work plan. Again, we're working, our plan is to reach out to our cities and to the code enforcement departments or SEC units within the building departments in those cities, so that we can get together and kind of go over a standardized approach on how we would do this for each individual city, and then have those individuals available within their respective cities to provide that service. That is what we're working on. Hopefully that's ultimately how it ends up.
Well, that sounds like a really proactive program, and hats off to you guys for providing that to the business community. That's really great.
Thank you.
So, Jeff, if you can just help us, just for the people who's watching, to explain to us at which stage we are and which businesses are able to operate as of now, just to have that detail.
Sure. We're currently in stage 2, low risk. We are at the same stage that the state has moved into. Obviously, there's a number of counties that has moved into the stage 2 high risk. I think at this point, I believe there's about 39 counties that have moved into that. At least as of 8 o'clock this morning. They may have approved others since then, but as of 8 o'clock this morning, there are 39 counties that are in the high risk, including San Diego. Right now, we're in the low risk category, which in essence, it still covers what was done in stage 1, which is our essential workforce and businesses that they're still operating and providing that service. But in addition to that, it allows, which is our retail food facilities, that that's part of the stage 1, which allows them to either pick up, deliver food for their customers. What's happened when we transitioned into phase 2, it's allowed those retail businesses that were not considered essential, it allowed them to move into curbside pickup. So that has happened. It also has allowed golf courses and parks to open for recreational purposes. So that's basically about it. Now it's fairly limited. We hope at some point we can transition into stage 2 through the variance process. If we are unable to obtain that, then we'll end up moving through into stage 2 high risk when the state makes that move.
Thank you.
Jeff, do you have any other final comments if for the business owner out there?
I think the biggest thing right now is to start working on their business. We're very hopeful that we can move forward and move into stage 2 high risk, which will allow a number of the businesses to open their doors and provide some degree of service. So getting their business ready. If there are barriers that they need to construct or install, they should start working on those now. Again, we want them to begin looking through the work site specific protection plan so that they know what it is. They can look at that to determine what part of this plan is applicable to their business, so they can start looking at what measures they need to implement. If there's additional items that they may need to acquire to meet some of these guidelines, then they can start working on that as well.
So Jeff, if you're say a hair salon owner or the owner of a gym, and those kind of businesses are going to be kind of the last to really be opened up, or later on down the road, would it be too early to have the county come in and assess the workplace, or can they do that anytime?
They can do that anytime. And just to touch briefly on that, I know that in the last the Monday call that we had with the state, so this whole program, this stage and the movement of the stages and the various business sectors that are in the different stages, stage 3 or stage 4, it's very fluid. So as you can see with the governor, there's been a lot of things that have been moved around. I know the governor the health department, the state health department, on our conference call on Monday did talk about the possibility of moving barbershops and beauty salons. Didn't include nail salons, but barbershops and beauty salons possibly into the high risk phase 2 or stage 2. That was just a discussion. We're hoping to hear more during tomorrow's. I believe they have a conference call tomorrow, so hopefully we'll hear more about that. So with that, we see, again, they were all originally in stage 3, and as we think as things move along, as we get more preventative measures put in place, and as they understand these industries a little bit better, there's a very good possibility some of these industries that are in stage 3 or stage 4 may move into stage 3, or it may move into the high risk of stage 2. So again, it's very, very fluid. I would always encourage the businesses to continue to look at their business, whether they're in stage 3 or stage 4 or the high risk of stage 2, to look at what they need to do to get ready to open when that opportunity is available to them.
Okay. Venus, do you have any questions for Jeff or any final comments for the business community?
No, I think that was a very comprehensive plan.
Okay. Okay.
So Sean, we have a question here on the chat. Mr. Robert Gronick is asking if they're going to be able to accept cash when they're open. And I believe this is for retail industry.
There has not been any guidelines that would restrict the exchange of currency at this point in time.
Jeff, what about if you're a restaurant owner and you know, you're using the old, you know, format of physical menus that are being passed around? How should a restaurant owner you know, work around that?
Sure, and again, going to our website or the state's website, we've aligned our, you know, the guidelines and our stages along with the state. And in the states, they have their guidance document. They have one specifically for restaurants or in dining facilities, and so there is specific guidance with regards to their menus. They and I can go back and also hit the currency. I have one more comment on that. Let's talk about the menus real quick. With the menus, the recommendation is that they have a menu, is a single-use menu that it can be disposed of after the dining experience for that particular customer. If they end up having to use multi-use menus that's going to be used over and over again, then the recommendation is that they disinfect, they sanitize those menus after every use. And so they need, again, that's part of what the business needs to decide and what mechanisms they need to put in place to ensure that's happening. Either they have enough adequate disposable menus, or they have a method of cleaning the menus each time after use. As far as the currency, there is no, as I mentioned earlier, there's no guidance, or there's no guidance prohibiting the exchange of currency. Obviously, in the guidelines for retail operations, they encourage touchless type devices for transactions and things of that nature. So we see a lot of businesses that are switching over to that. They have been for some time, even prior to, you know, pre-COVID. I think what's happening now, you'll see a lot more switching over to those touchless systems.
Very good. Meredith, did you have any final questions or comments?
Well, the only thing is, thank you very much for all the details. We're having daily calls with our business owners about how to be prepared to reopen and to get back into this new normal. So just one last comment for the business owners who are watching this video, please contact us, the Small Business Development Center, our partners with the Business Recovery Task Force, with IBDC. We're working directly with all the leaders just to make sure that we have the resources and all the information for you to be ready. So if you have any questions, please let us know. This is really critical for our community to get back and to move faster into these stages that we want to be back in business, but it's going to take all of us to make sure that we're working together. So thank you.
Thank you. And thank you, Jeff and Venus and Dr. Vo from the Vo Medical Center. I think our county is extremely fortunate to have folks like yourselves in the leadership positions out there, you know, being a conduit with the business community between the private sector and the public sector agencies that you both represent. So, you know, we can't thank you enough. You know, Meredith and I and our team back at the SBDC and IBEDC, we've all worked extremely diligently over the past couple of months to assist business owners in getting access to capital that they need with their Paycheck Protection Program loans and their EIDL loans, their disaster loans and whatnot, and help them through a lot of the workforce challenges that they're having as well. But, you know, we really appreciate, you know, Jeff and Venus and Dr. Vo being here and helping us with all the questions that the business community has right now. There's a lot of uncertainty, and so any guidance that our business owners can absorb right now really, you know, gives them a major level of comfort right now. There's so much uncertainty and questions that need to be answered. So we can't thank you enough.
Thank you.
All right.
Yes.
We have one last question, and this is for Dr. Vo. Adrian Ramirez is asking, is COVID currently affecting children in the Imperial Valley?
It does. It affects all ages, all populations, from infants to adults to the geriatric populations. So yeah, it affects everyone. So in the past 2 weeks, we've seen a surge in a lot of sick patients that are coming in that are very sick due to the COVID. They tested positive and they came in sick, from the young to the old. Youngs, we've seen children coming in with rash, abdominal pain, diarrhea, excessive vomiting. So we do see that. And then for the young adult, we've seen a lot of young adult coming in with headaches, loss of sense of smell, taste. Those are very common complaints. Fever, chills, body aches, very common in the young adult. And then in the mid 40s and 50s, we start seeing patients who be very fatigued, tired, again, symptoms of fever, cough, and now we're starting to see more GI distress, like again, diarrhea, vomiting, abdominal pain associated with this virus. Yeah, so we've seen a lot. And then the elderly, some patients, they will have GI distress along with respiratory distress. So we've actually sent a couple of patients over to the hospital as of last week due to the COVID-related issues. And yeah, we do see a surge in a number of patients that are coming in. And right now, like I said, as I mentioned earlier, at both facilities, El Centro and Calexico, we're seeing on average about 400 patients a day that are coming in because they have questions, because they were exposed, or they wanting to get tested, or they needing treatment. Yeah, so we see a huge surge. And we also see a lot of outbreaks in at the workplaces, a lot of outbreaks. And people are fearful. They are very fearful. So we hear 7 days a week. We are very accessible. So if a patient has questions, they can call us, or they can just come in as a walk-in. We have a lot of patients who are sick, and I just tell them, go ahead and come in and walk in. Make sure that you have a mask on, at least 6 to 8 feet apart, facing one direction, waiting in line, and our staff will come out and see you quickly. So we are very accommodative, yes, to everyone, and we don't turn sick patient away. That's our policies. We never turn sick patient away. If we could help them, we would. Yes.
So Venus, you mentioned that you're testing 400 to 500 patients in Imperial County a day. Do you have additional capacity? Can you take on more?
Yes, we have the ability to do that. We've done that from the very beginning. We were able to mobilize really quick and fast and get to smaller cities. So we started first in Calexico. That's where our urgent care office was. And then we moved to El Centro. That's our second locations. Then later we moved over to Brawley and Holtville because people there are needing access to testing. So we mobilized and we moved to smaller cities to provide testing. A lot of people, field workers and beef workers, weren't aware that there was testing available to them, diagnostic testing that were available. So we came to them actually, and we speak to business owners, we speak to local communities, we speak to local leaders, making sure that they know that the testing are available, and that if they need it, they can come and get the testing on the same day. We make ourselves really available, and we have the capacity to test more if needed. Yes.
Okay.
And our office have in-house high capacity lab, like I said. So in the near future, hopefully in a week or so, we would be able to run those tests, and we would be able to give you the results back, turnaround time, quick and fast, and accurately. That's the key.
Very good.
And let me say something good news. So we have youngest patient. We did 4 months, and 4 months, but asymptomatic. So no problem. Just the family wanted to test, so we did test and came back positive and patient asymptomatic. The oldest one we did 89, still have some symptom, minor symptom, but no problem so far. We continue monitor, but patient really doing well, no issues. So not even need treatment. I just give him a little bit of aspirin, cough syrup, allergy medications, but nothing more than that. And they're doing well. So that's the good news. Youngest and the oldest in the valley we did for the test. And of course, for the past week, we see a lot of employers start sending patients to our office. That's why the show's coming higher. I think they're probably getting ready for reopening. Probably that's why a lot of we see dentists came to our office to get ready. A lot of internet informations company came to my office to test. Yeah, so and a lot more, but I won't let names here. But I think that's the key now. I think if we do tests, family, patients, and employers are more comfortable to restart the business. And we also in the process talking to school here. Of course, we're not be ready for that, but we're working in progress to see how we can help the school as well. So yes, so I think we are ready to help, but I think it's probably gonna take a little bit more effort and a task force to do it.
Right.
So thank you.
All right. Thank you very much. Thank you everyone for joining us today. If there's not any final questions.
We have one. We have one.
We have one. Okay, go ahead, Meredith.
Yes, one last question with Mr. Guzman. What are the after effects after having COVID-19? He's thinking of the employees coming back after recovering that we should be looking out for. So recovering after having COVID-19.
Is that for me?
Yes.
I thought for Mr. Guzman. I'm sorry, say it again, the questions.
So the question is, what are the after effects after having COVID-19? After being positive, and then you want to go back to work.
Okay, so yeah, we have a lot of positive so far in our office, probably more than right now, more than 600 positive in our office alone. We recommend them to, of course, continue more symptoms, stay home for 2 weeks. But in a 1 week period, call me back to follow, this is how they're doing. If they have a symptom for 7 days, I recommend to retest again. If they have more symptoms, we recommend to continue more another week, so 2 weeks total. But the public health guideline, they have to stay home for 2 weeks unless they have to test negative within 24 hours. So those are people who really want to go back to work, we test sooner. If they come negative, they're good to go back to work. But again, if they're sick, clinically, they have to call me right away. They can call even my cell phone, my Facebook Messenger, anyway they can talk to me, because that's very important. Otherwise, this disease is getting bad quickly. Yeah, they get sick very quick. Today normal, but tomorrow in the hospital. Yeah, so that's the tricky. It's not like fluenza. You can get quick, slow, going downhill slowly, but here, yeah, very quick. So those are the guidelines that I recommend all my patients. Of course, sick, call doctor's office. If you get better, call me in a week to retest, or you have to wait for another week to get ready to go back to work.
Perfect. Thanks.
Yeah.
All right. Very good. Unless anybody has any final comments, we might conclude. Thank you everyone for joining us.
Thank you, Son. Thank you, Meredith.
Thank you. Thank you very much. Thank you for everyone.
Thank you everyone, and God bless. I hope everybody stays healthy, and good luck on opening your business and operating in a safe manner. Thank you.
Thanks.
Bye.